I have fourth stage colon cancer, and I am being treated here at NYU. And Dr. Cohen is my oncologist and the captain of my team. I have had, I've had 5 surgeries, chemo, and radiation. And now I'm going to calm down. Dr. Cohen did this to me. I got, in 3 months, I will have had cancer for 5 years. It's hard for me to believe that it's been that long, but actually, it's been a long slog. I got cancer because of a couple of factors, but I was not screened. I was 65 and had never had a colonoscopy. Even though my father had had colon cancer, and it was in exactly the same spot in the colon, in the sigmoid. And I was very athletic, but I was really basically asymptomatic, except for a little bleeding that I attributed it to rehabbing my knee. I had a torn ACL in my knee. And from the time, I did that when I was in my 20s. And so for 30 years, I was lifting heavy weights, putting all this pressure on the bottom of my spine, and had a history of hemorrhoids, and had bleeding for 30 years, off and on. So that hampered me in finding it. So at 65, I'm going to get a knee replacement surgery, and they found that I had an inflammation somewhere in my body. I had a low-grade temperature. They said, they did pre-op tests, lots of stuff. And when I told this doctor I'd never had a colonoscopy, they said, well, you better have one. Boom, third stage. It was large. It was, it had moved to 2 lymph nodes. So I was stage 3. And I was fortunate enough to meet Dr. Mitchell Bernstein, who really saved my life in terms of not just doing fabulous surgery, but teaching me how to approach cancer. So I was stage 3, and I was presented with Dr. Bernstein, and I knew that I really needed knee surgery because I couldn't walk. My knee had degenerated to the point where I could not function. I couldn't walk. It was beginning to affect my hip. So the adjuvant chemo that Dr. Mitch said was the norm would prevent me from having knee surgery for a long time because it reduces your immunity, and then doctors don't want to operate on you. So I chose to have my knee replacement. And once I rehabbed, Dr. Bernstein sent me here to Dr. Cohen. And she found a very large tumor in my liver. And so this began the first stage of my cancer experience, where it was full-out attack of heavy chemo and trying to reduce the size so that hopefully I could have liver surgery, which actually happened. Everything that NYU did worked. It worked wonderfully. And Dr. Elliot Newman resectioned my liver, and I thought, I'm finished, that's it. I'm done, and I survived, and lucky me. And then about 7 months later, it was found in my lung, where it is now. So on Monday, I will have a CT scan. There's a little thing in my right lung. 4 months ago, I had my latest lung surgery. So it's every 3 months CT scan. And so that's the situation that I'm in now. I will see Dr. Cohen in 2 weeks to find out the results of my scan, to see what we do next. So how have I been doing? I've been doing great. I am very healthy, and I'm very happy, and I'm enjoying my life. And I've learned how to handle this, first from Dr. Bernstein, who taught me that I couldn't possibly deal with the big picture of having 4th-stage cancer. He said, stay right where you are in the present moment. Do not think ahead. And that don't think ahead has worked so marvelously for me. I mean, I actually do this. And also, my sister who has leukemia is using the same approach. Don't think ahead, don't regret and think back, and don't look ahead. Just think, what am I doing right now? What treatment am I having, and what am I doing now? So this works very well. And also, I learned from Dr. Cohen, which was very helpful. She early on, and I can't believe we found the thing in my lung 3 years ago. I can't believe we went from that big crisis situation with my liver to this kind of weird, nebulous things come up, and then I have surgery, I have maintenance chemo, something comes up, I have radiation. It's weird because I can't shake the cancer. So I have to continue this thing where the work of my life, oh yes, let me tell you what Dr. Cohen taught me, is that I am not a statistic, and she advised me not to go online and see what the percentages are. So that was very helpful because I did that a little bit in the beginning, and then I got confused, like, now wait, is it 80% chance that I'm gonna die, or was that the 20%? You know, it just drives you crazy. So she taught me that I can't look at the odds, that it's me with the cancer, and who knows? I mean, we're all using only about 80% of our brain anyway, and I don't know what powers I have, but I am doing certain things that I think are getting me through. I do very strenuous exercise. I view having cancer as a constant situation of rehab. I've been in rehab, physical rehab, for almost 5 years. All I do is rehab. I have chemo. I have to rehab in that 2-week period between infusions. I rehab to get ready for the next one. I rehab after each surgery. I know that the chances are great that something else will kill me if I'm strong. So I'm always working out and always rehabbing, and when they operate on me and they cut through muscle or whatever, then I have to wait 6 or 8 weeks before doing certain exercises, and then I go back. So I feel like I'm in the Olympics. And on a behavioral, I do this terrific behavioral work that really works well for me. I discovered it back in the 60s. Psychocybernetics I use heavily, where on a day-to-day basis, I pretend that I'm someone who doesn't have cancer. I don't trick myself into believing that, but I sort of act as if in a day-type tight compartment. I do it one day at a time. I pretend that I'm someone who's healthy because I'm trying to bring back that feeling of well-being, even if it's only for a couple of hours a day. What cancer took from me was my feeling of well-being, which was my hallmark, I felt. And I can sometimes trick myself into this endorphin rush by acting as if I don't have cancer, and by listening to music. Music is very powerful I put the music in my body, and it really works very well for me. And I stop myself and I look and listen at all the people that I'm dealing with who are treating me. It's really astonishing what Mitch Bernstein showed me was that the big cancer is impossible to do, but the steps along the way, I must say, have been very doable. I won't say they've been easy, but I can do them. They're not that bad. You have all these people. I don't think I've ever met one person in all these years of being treated that wasn't like an angel, actually. Everyone is there to serve, and everyone is there to help. And so if I put my attention on doing my best and surrender, I surrender myself, and that's a spiritual practice that is very useful. I resist. I'm having a CT scan this coming Monday, so I'm beginning to be fearful, and I resist. But you can't resist fear. You have to let yourself feel very afraid. And then I'll find out if it's awful news or good news. And then if I have to be treated, I view it as if I am surrendering my body. No resistance, just give it up. Go in, let them operate, and it really can leave you cool as a cucumber if you just figure, well, whatever, you resist and you fight, and then you think, oh, okay, and then you surrender. So the surrender has been very useful for me. And now I am waiting to, I used to wait to just I've never been cancer-free, but I would like to be cancer-free for a period of time. And I believe that that's possible. I didn't believe it was possible before, but now I do. I think that some immunotherapy may be coming my way. I believe something's happening in my body that's keeping it at bay a little bit, but I don't know what it is. But I'm hoping for the best, and I'm actually very hopeful. So thank you very much for listening.